Hi, I'm Linnea. Welcome back to my channel. This video is part 2 of the Ultimate Guide to Gastroparesis, also known as the videos that I wish I could have had access to a year ago when I first started searching for information about this rare and debilitating illness. In part 1, I explained what gastroparesis is and I discussed the causes and symptoms in much more detail than I will in this video. So if you want more information about gastroparesis itself, I would personally recommend watching that video. The purpose of this video is to provide comprehensive information about the treatment and symptom management options for gastroparesis. I'm going to explain all the options for managing the symptoms of this condition that I am currently aware of, but I'm sure there'll be medications, surgical options, and herbal interventions that I miss. So please feel free to comment below with any information that you have about treatments for this condition so that we can all learn more and then have more options for making life with gastroparesis more manageable and functional. This video also applies to people who have been diagnosed with functional dyspepsia. If you want more information about how intertwined these two conditions are and how easily a gastric emptying scan can misdiagnose people with either of these conditions, definitely go back and watch part 1 of this series. In short, a gastric emptying scan is only 4 hours of your day on one particular day in your life with one particular meal, and you can still have gastroparesis, even severe gastroparesis, with a normal scan. Again, to hear all about that research, go watch part 1 of this series where I really get into everything behind that statement. I feel a bit emotionally conflicted about the topic of this video because I feel like discussing treatment options should be a hopeful experience, but for me, it is hard to have hope about life with this condition. I know that is true for a lot of other people as well. Gastroparesis has taken away my physical strength, my favorite foods, and the majority of my social life beyond the interactions that I have on the internet. I know most people feel as though after receiving this diagnosis that their lives will never be the same, and I am definitely one of those people. There are so many unanswered questions with this disease. For some people, their symptoms get better over time. For some people, their symptoms get worse over time. For some people, their symptoms, gradually progress and get worse. And for some people, this disease literally appears overnight and then never goes away. It's really freaking terrifying, and there's so many different causes of this disease, including huge chunks of people who are labeled as idiopathic or cause unknown, as if that explains anything at all, when it really just leaves a person with way more questions than before. I am so scared that my gastroparesis will keep getting worse and worse, and that my diet will just dwindle into nothingness. I'm actually already worse than I was a couple years ago when my symptoms started, so it's super scary for me. Before I jump into the meat of this video, I want to address a few things. First, I am not a doctor. I am not a medical professional of any sort, and this is not medical advice. The information in this video is for informational purposes only. Secondly, all the resources that I use to make this video will be linked or otherwise listed in the description. So if you want access to full versions of any of the articles, videos, podcasts, and studies that I use for research, you can easily access those by checking the description. And lastly, if you have made it to this video, you are likely here because you physically cannot eat any more than you currently do, no matter how easy to digest the foods you consume are. There is a saying in the gastroparesis community that we are starving for a cure, and sadly, that statement feels really, really true. We have to get really sick before we qualify for meaningful interventions, and as you will hear in this video, the most meaningful interventions are all surgical interventions, and none of them are guaranteed in any given case. There are so many people out there who are in limbo, relying on nutritional shakes or feeding tubes in place of all the foods they used to love and that they used to, eat and give them joy. And they're just waiting for a cure. I have the utmost respect for anyone and everyone living with this condition, and that is the reason I'm making these videos. I want to help or give comfort to anyone that I can, including friends and loved ones of those, with this condition. I acknowledged in part 1 of the Guide to Gastroparesis that the illness is certainly more common than is currently thought to be the case. However, the biggest confirmation to me and my personal life that this is also still a rare illness is how hard it is to help others understand what we go through. Even my husband, who lives with me and listens to me talk about this illness daily. I do want this video to give hope to you, the viewer, and to me as well. I'm going to start with the interventions that I have most access to right now, which are dietary interventions, supplements, and herbs. With any case of gastroparesis, doctors will start with diet. as the first intervention 99% of the time. Of all the gastroparesis stories that I've read and listened to, and also in my personal experience, I have never heard of a doctor not recommending treating symptoms with diet first. I have linked the same diet resources that I discussed in my last video. So the video from Clinical Nutrition University, the Cleveland Clinic Diet Guidelines, and the Mayo Clinic article about gastroparesis. The general gastroparesis guidelines can be summarized with this one sentence though: low fat, low fiber, and small frequent meals. The gastroparesis diet guidelines seem intimidating upon first read, at least they did for me. However, as my illness has progressed and my tastes have changed as a result of many painful and vomit-filled nights, I naturally now gravitate towards foods that are in line with the guidelines without even thinking about what foods I am supposed to eat according to the guidelines. However, there are still plenty of foods that I consider safe foods that do not fit these strict guidelines. Every single person with gastroparesis is going to have different safe foods and different trigger foods. And unfortunately, we all have to figure that out on our own. I'll give some examples here of my best and worst foods. I will start with my safest foods. So for foods that I find to be safer, we have cheese, bread, crackers, drinkable yogurts. I have between 1 and 4 of these a day, depending on how much I need to swap out solid meals for liquid ones. I basically treat drinkable yogurts like my version of protein shakes. Dark chocolate, white pasta, tomato sauce, granola bars, and fruit juice. Cheese and dark chocolate are higher fat, but I can tolerate them much better than other higher fat foods such as peanut butter or fatty meats. I almost never eat meat or fish because I get so nauseated from it. So for my most unsafe foods, I would say oatmeal. Number one, oatmeal always makes me sick. Also, any and all vegetables, cooked or raw, but especially raw. Greens, I literally eat one piece of lettuce and I start to feel sick. And as I mentioned before, most animal foods aside from dairy. Eggs used to be okay for me, but now they make me as nauseated as meat and fish after like only a few bites. I also used to be able to handle nuts and nut butters pretty well, but lately they have not been sitting well at all. Suggestion on diet is to look over those resources, talk to your doctor or better a dietitian, and spend time finding out what foods work or don't work for you personally. I have also heard that some people with gastroparesis have success with the low FODMAP diet, especially in terms of bloating and gas issues. I tried the low FODMAP diet for a while. I even bought 8 low FODMAP cookbooks when I was convinced that it would cure me. All those books are now gathering dust on my shelf, honestly. Low FODMAP helped me for a couple of weeks, but then things went back to normal, even worse than they were before, honestly. And I stopped doing the diet because it got rid of most of my best safe foods that I now need to rely on even more, especially when I have flares. When I'm in a flare, I'm living off crackers, fruit juice, and those drinkable yogurts, and none of that stuff is particularly low FODMAP. When it comes to supplements, every single person with gastroparesis is going to have different products and doses that help them. I absolutely suggest doing your own research and talking to your doctor as well. For this section, I'm going to discuss the supplements that I have tried, as well as the recommendations of a few other creators with gastroparesis, and you can kind of take from there what you want. The only supplements that I've been able to take consistently are the Silver Fern Ultimate Probiotic and Prebiotic. I take them because they help so much with my lower GI motility, which is a major part of me keeping my gastroparesis symptoms under control. If my intestines get backed up, I have much more vomiting, much more nausea, and I sometimes feel like I end up in flares that last for weeks. I also take an omega-3 supplement because I'm not able to really get any omega-3 rich foods in my diet. Other supplements that I've tried and that are currently taking up space in my cabinet include digestive bitters. I have 3 different flavors. I could never get consistent with these because they're supposed to be taken before every single meal, and I just forget to bring them with me places, and I forget to like make them before I eat something. I just forget to take them really. I also have artichoke extract pills, marshmallow root pills, apple cider vinegar. People recommend to take this in water before meals. I tried it a few times. I never stuck with it. And I also have some aloe vera juice that I keep in the fridge. I really want to start taking it daily because I've read a lot of great things about its gut health benefits, but I just haven't found a way to integrate it into my routine yet. Another supplement that I used to take very regularly is magnesium calm. I used to take it at night night with warm water for constipation relief, but now the taste of it triggers my nausea, so I no longer take it. Izzy, who I mentioned in my last video, has a fantastic video about what tactics she used to improve her gastroparesis over time. I have linked it below so you can hear her full story, but in summary, she suggests trying Gas X. She said that really helped with her bloating, a heating pad to help with pain. I know it's not a supplement, but still, betaine HCl, which she claims helped her digestion, especially when she ate high protein meals. She said that she would typically eat up to 8 pills with her meat-based meals, and then she slowly weaned down the dose and got off of them when she felt better. And she also suggests super enzymes or digestive enzymes, which she said helped her a lot when it came to pain and bloating with plant-based foods. She also said that she would try ginger candies for nausea, but they did not help her that much, although sucking on the candy itself was soothing. She also discusses her experiences with pharmaceutical nausea medications, which we will get to later on in this video. Another creator who shares some great suggestions on supplements to ease gastroparesis symptoms is from Holly Palmer. This video is from over 5 years ago, and Holly no longer makes videos, unfortunately, but the supplements that she shares are interesting and different from what I've seen from other creators. She also mentions that she tried both Reglan and domperidone, which are two of the very few pharmaceutical medications out there for gastroparesis, which once again, I will discuss in more detail, much more detail in a few minutes. She recommends Hyland's motion sickness tablets for nausea, and she talks about them so highly that I really want to try them. She said that these tablets help her more than Zofran, which is this pharmaceutical I turn to when my nausea is the absolute worst. She also recommends ginger pills. For me, the concentrated pills cause heartburn, but I do tolerate fresh ginger juice and the strong ginger candies from the Ginger People. I often eat some form of ginger daily to assist with my motility in all parts of my GI system. Lastly, she recommends Iberogast and CBD oil for indigestion, nausea, and reflux. She says the Iberogast has been a game changer for her, and it is on my list of supplements to try as well. She says that she takes the CBD oil in the mornings, and it also helps her a lot with nausea. The last supplement advice that I will share is from Kenna Kruger in her recent video about her gastroparesis safe foods. It's a great video for some meal and snack ideas for foods that a person with gastroparesis may tolerate. As far as supplements, what she recommends is technically candy for nausea, but I wanted to mention it here because candy helped me at times too. Kenna suggests Ginger Chews, natural peppermint tummy drops, pink stork nausea sweets peppermints, Preggy Pop morning sickness drops, nausea wristbands, the Queeze Ease nausea stick, and peppermint lifesavers. So if you are looking for nausea candies or other natural remedies, I hope those suggestions help. Before I get into pharmaceuticals and surgeries, trust me, we are getting there, but once we do, you'll understand why I talked so much about these alternative remedies, as there are no particularly great medications for gastroparesis itself. But anyway, the last option I want to discuss is herbs. I have been curious about the benefits of herbs for gastroparesis and for overall gut health and mental health for a while, but I've only recently really committed to making herbs a part of my daily life, and honestly, it is already making a gigantic difference for me, especially in terms of my motility. There are a lot more videos delving much deeper into herbalism and the benefits of particular herbs and practices that I will be making in the future, so for more information about my experiences with herbalism, stay tuned to the channel, but I'm also going to provide some really great resources here in this video for learning more about the types of herbs that could help you if you have gastroparesis or other stomach problems. There are so many great herbs out there that have anti-inflammatory, soothing, and calming benefits on top of the gut health and motility benefits, so you can really customize the herbs that you bring into your life and use in teas and other herbal applications such as tinctures. I started learning about herbalism from some great Instagram accounts, and these are my 3 favorite pages. The first account that I found was Ashley Savay Health. Ashley is a nutritionist and herbalist who posts amazing infographics about the intersection between herbs, diet, and gut health. It was her advice that first got me thinking herbs could help my symptoms in the way that they have. The next account is Wellness with Linz. Lindsay has recovered from multiple autoimmune diseases through the power of herbs and has a great story to share. She also sells her tea blends through the brand Drink Simbi. Drink Simbi not only has some excellent teas, but they also have a blog with detailed information about various herbs and their health benefits as well. And lastly, I literally just found this account and they followed me back, but it's truly a gold mine for extremely well-researched information about herbs. The account is called Evolutionary Herbalism and is run by a couple who also runs a blog where they post awesome, super detailed articles about specific herbs and other topics related to how herbs can help with physical and mental health. I also recommend checking out Mountain Rose Herbs. They have a website, a blog, an Instagram, a podcast, and a YouTube as well, all with fantastic information. They also sell great quality herbs and tinctures, as well as extracts and oils. I found them while looking into natural skincare before I even got interested in using herbs to help my gut health. In fact, the best information that I've ever found about gut health and natural healing and herbalism is from their podcast called Herbal Radio. I highly recommend listening to this podcast. The episode is called Botanicals and GI Health, a Holistic Approach with Dr. Tiranoa Lodog, and even though the episode is nearly 90 minutes, every single minute is packed full of examples from Dr. Tiranoa's medical experience, citations of quality scientific studies, and stories from Dr. Tiranoa's life. She discusses the dangers of proton pump inhibitors in detail because most of her recommendations are on alternative routes to getting relief from the symptoms of GERD and other reflux disease type symptoms. So if you have a lot of issues with acid reflux and heartburn due to your gastroparesis, you should certainly take the time to listen to this episode. I was prescribed proton pump inhibitors really early on in my gastroparesis journey, and I declined taking them because I knew that lowering the amount of stomach acid in your stomach can cause so many issues far beyond just impaired digestion down the line. And Dr. Tiranoa really dives deep into that concept in her talk. She is such a well-respected member of the medical community and leans on studies from quality journals so heavily in this talk that even my husband, who can be very skeptical of herbal benefits, was fully won over by her advice and expertise. The link to this episode is in the description, and my current herbal collection is deeply influenced by her suggestions for herbs that promote motility and gut health while lowering inflammation. As far as the herbs that I currently use and that are in my cabinet, I like dandelion root, dandelion leaf, licorice root, ginger root, peppermint leaf, lemon balm, lavender, chamomile, lemongrass, and valerian root. I also have some marshmallow root and some slippery elm powder, but those are not a part of my daily routine yet. Lastly, I do have a recommendation for a pre-made stomach soothing blend that I've recently become obsessed with. It is called Happy Tummy Tea from Tin Roof Teas. It contains catnip, spearmint, lemongrass, calendula, skullcap, rosemary, sage, and fennel seeds. You can get it online or at their local store in Raleigh, North Carolina. And finally, we are getting into the options that you will need a doctor's intervention to have access to. All of the best resources that I've found for information about the medication options for gastroparesis are linked in the description. A lot of what I'm going to say pulls from the combined knowledge of these sources, but I will cite directly with quotes when necessary. I certainly recommend reading or watching these resources for even more in-depth information that I can provide here in this summative video. Medications for gastroparesis can really be divided into 4 categories: anti-nausea medications, medications that specifically promote gastric emptying, off-label medications, and medications that promote overall intestinal motility. Many people who use pharmaceutical interventions for gastroparesis will be on one or more of these medication categories at some point in their journey with gastroparesis or throughout the majority of their journey with the disease. It really depends person to person, obviously, what medications they take. The first medication I was on was Reglan, which specifically aids with gastric emptying. I also take Zofran on an ad-needed basis for nausea, and for a couple of months I took a very high dose of Linzess, which helps with intestinal motility. There is one other medication-related intervention that can help ease gastroparesis symptoms, and that is potentially weaning off medications that can cause gastric slowness. The best example of this would obviously be opiates. If a person is on opiates and it has caused them to develop gastroparesis, the first step in their medical treatment, if possible, would likely be getting them off opiates. This is something that Dr. Fikre discusses in her article about mistakes in gastroparesis that I've referenced in my last video and will again use in this video. As far as nausea medications, the one that works best for you should be determined by you and your doctor. My personal favorite is Zofran. I get the dissolvable tablets, which ironically taste freaking awful, but do help a lot. Zofran can be constipating, so I only take it when my nausea is like really unbearable. In her video, Kenna Kay talks about how much Zofran really has helped her throughout her gastroparesis journey. Izzy also mentioned Zofran as her favorite nausea medication in her video, as well as two others, Compazine, which she takes for mild nausea, and Amend, which she got in the hospital via IV. For some people, diet changes, nausea medications, and some of these supplements and herbs that I mentioned earlier are enough. For me, the occasional Zofran and paying super close attention to my diet are enough. However, I do worry about the fact that there are so many days still when I physically cannot eat much food, but there is nothing I can do about that right now. It is just the way that I will have to live. As far as medications that help with gastric emptying itself, there are 4 medications, and none of them are particularly useful or safe. This is why even someone with really delayed emptying is likely still not going to be on any of these medications long term. For example, I only took Reglan or metoclopramide for less than a month, but most doctors will allow it for a maximum of 3 months in really extreme cases. US Pharmacist describes the way that Reglan works by saying, quote, "This first-line therapy for gastroparesis is a dopamine 2 receptor agonist, a 5-hour HT4 agonist, and a week 5 HT3 receptor agonist. It improves gastric emptying by enhancing gastric antral contractions and decreasing postprandial fundus relaxation. Reglan can be taken up to 4 times a day and is always taken about 30 minutes before a meal. Reglan is still the only FDA-approved medication specifically for gastroparesis, and it is also prescribed to help with GERD in some people because it can reduce heartburn and acid reflux. The Mayo Clinic breaks down the dosage differences between GERD and gastroparesis, but in both cases, the amount taken is typically between 10 and 15 milligrams at a time, typically not to exceed 60 milligrams a day. The Mayo Clinic also provides a long list of precautions with this medication. It can make you dizzy, drowsy, and interact with many medications, especially those that already cause drowsiness. This medicine can also cause tardive dyskinesia, a movement disorder. The Mayo Clinic advises, quote, "Check with your doctor right away if you have any of the following symptoms while taking this medication: lip smacking or puckering, puffing of the cheeks, rapid or worm-like movements of the tongue, uncontrolled chewing movements, or uncontrolled movements of the arms and legs. The risk of tardive dyskinesia is much higher if you take this medication longer than 12 weeks. Treatments for longer than 12 weeks should be avoided in all but rare cases." Dr. Fikre also discusses the dangerous side effects of Reglan and says, quote, "Metoclopramide is associated with extrapyramidal side effects such as dystonia and aphasia after a single dose, or tardive dyskinesia and Parkinsonism after prolonged doses. Therefore, metoclopramide should not be prescribed in the long term." So in summary, the only FDA-approved medication for this condition is rarely ever used for longer than 12 weeks because of risk of dangerous side effects. Another medication that is used for stomach emptying itself is erythromycin. According to the US Pharmacist, quote, "The macrolide antibiotic has been available since the 1950s. It is rarely used as an antibiotic today and is primarily prescribed for its prokinetic effect on the GI tract. It has been used successfully off-label for the treatment of gastroparesis and other GI hypomotility disorders. When erythromycin was used as an antibiotic, patients often complained that it caused abdominal pain. Researchers eventually determined that erythromycin stimulates motilin receptors in the GI tract. Motilin stimulates GI contractions and results in increased GI motility. This medicine also increases stomach muscle contraction and improves gastric emptying. The US Pharmacist says that both the oral and IV route of this medication are effective. However, in his talk for Henrico Doctors Hospital, Dr. Matthew Brangman, whose practice is so focused on gastroparesis, over 50% of his patients have been diagnosed with the condition, he says that erythromycin is really only best used in the IV form, and he states the oral route is not very effective. I highly recommend Matthew Brangman Brengman's gastroparesis seminar for more information about gastroparesis and gastroparesis treatment. He goes into detail about medications and surgery especially. He also mentions that Reglan is very effective when people typically initiate therapy, but it becomes less effective over time in the majority of people. The same has been proven true with erythromycin. This is something that Dr. Ficre explains in her article, saying, quote, erythromycin is associated with tachyphylaxis, which means that it should be limited to a few weeks. For acute flares, it can be used as an add-on to existing treatments, after which time it should be stopped. Tachyphylaxis means a rapidly diminishing response to the drug, so its efficacy quickly wanes over time. And again, this is a drug that cannot be used long-term. The two other medications that can directly impact gastric emptying are both not available in the United States, and for good reason. Domperidone is, quote, used to treat nausea and vomiting, as well as complaints of the stomach that occur with delayed emptying. It is used in patients whose symptoms fail to respond to metoclopramide or with side effects to metoclopramide. Domperidone is a dopamine 2 antagonist and is available for use only under a special program administered by the FDA. Both Holly and Kenna, whose videos I referenced earlier, have tried this medication. Matthew Brengman states that the FDA has been cracking down on people getting this drug from Canada, which is where Holly and Kenna got it from. Kenna had one of the dangerous side effects from it, which is lactation. The lactation is due to a prolactin-secreting tumor of the pituitary gland and can develop as a side effect of this drug. Dr. Matthew Brengman advises that the drug should be stopped immediately if lactation occurs because it is an indication that a tumor has formed on the pituitary gland. However, some women actually take domperidone to increase their milk production or to increase lactation, but the FDA warns against this. Quote, the agency is concerned with the potential public health risks associated with domperidone. There have been several published reports and case studies of cardiac arrhythmias, cardiac arrest, and sudden death in patients receiving an intravenous form of domperidone that has been withdrawn from marketing in a number of countries. In several countries where the oral form of domperidone continues to be marketed, labels for the product contain specific warnings against use of domperidone by breastfeeding women, and note that the drug is excreted in breast milk that could expose a breastfeeding infant to unknown risks. Because of the possibility of serious adverse effects, the FDA recommends that breastfeeding women not use domperidone to increase milk production. There are even more risks than just the heart issues and pituitary tumor formation, and WebMD lists some of these risks on their website, citing lower magnesium and potassium levels and other side effects as well. The final drug that I'm going to discuss in the aids with gastric emptying category is cisapride. Again, this medication is only available to people under specific conditions, and it can be the most dangerous of all 4 medications I've mentioned so far. I do not think I know of anyone with gastroparesis who has taken it. The US Pharmacy says about it, quote, this 5-HT4 agonist stimulates antral and duodenal motility and accelerates gastric emptying of solids and liquids, which in open label trials has been maintained for up to 1 year. Although cisapride is better tolerated than metoclopramide, its use has been associated with important drug interactions, metabolized, something about enzymes, it's in the quote, and which results in cardiac arrhythmias. So it's really freaking dangerous. In the US, prescriptions for cisapride can only be filled through an investigational limited access program from the manufacturer after providing documentation as to the patient's need for cisapride and assessment of risk factors for cardiac arrhythmias. So yeah, there are no particularly good medications out there for actually affecting the rate of gastric emptying. They're all dangerous and can only be used on a short-term basis. And it really, really freaking sucks. So we're gonna get into the other medications and the surgeries right now. For off-label medications, Dr. Lisa Lin has some great suggestions in her talk for UCLA Health on functional dyspepsia and gastroparesis. She suggests that buspirone, which acts as a fundus-relaxing drug, has shown benefit over placebo in clinical trials. I have taken Buspar at the highest dose for months before, but it was prescribed for my anxiety and I did not personally notice the gastric benefit. Dr. Lin says that this drug is used more in cases of functional dyspepsia, but I see no reason why it couldn't help gastroparesis patients as well. Although when I was on Buspar, it did make me really drowsy for a while, and that wasn't like a great side effect. Dr. Lin states that Buspar is more effective in improving symptoms of postprandial fullness, bloating, and early satiety as opposed to nausea and vomiting. Dr. Lin also recommends mirtazapine, which is an antidepressant. Mirtazapine has not been well studied in gastroparesis patients, but she mentions that it does improve symptoms for some people and is worth considering. The UNC Center for Functional and Motility Disorders also suggests that other antidepressants can be effective in improving the symptoms of chronic constipation. I know many gastroparesis sufferers also have overall GI dysmotility, and this is worth considering when looking to improve symptoms as well. I have linked UNC Health's full statement on the topic in the description, but the antidepressants that they cite as working best for chronic constipation are serotonin reuptake inhibitors, or SSRIs. The ones that they suggest are Celexa, Lexapro, Paxil, Zoloft, and Prozac. I have been on both Prozac and Lexapro before. I did not notice a change in motility with the Lexapro, but the Prozac certainly helped my gut motility for the few months that I was on it. However, I did have to stop taking the Prozac after only being on it for a few months because of the emotional side effects. So if you're going to go the antidepressant route, there is the potential that's going to affect your emotions. So just be aware of that. But that is a really good option out there for increasing overall GI motility. And that leads us into talking about the specific drugs that increase intestinal motility. Although these medications do primarily help with colon motility, and as I mentioned before, constipation can make gastroparesis symptoms a lot worse. And if stomach motility is extremely slow, that can actually just trickle down to poor intestinal motility. So it can kind of be, a situation where you might not start out with like both gastroparesis and slow intestinal motility, but it could be that as your gastroparesis gets a lot worse, that trickles down to your intestines as well. And they can kind of just play off of each other. Like there's a lot of interaction between the two, as I have unfortunately realized, and as I think a lot of people with gastroparesis realize. So it's like they have to be working together or there's gonna be problems. So a lot of people that have gastroparesis are gonna end up on like things that monitor their intestines as well as their stomach, basically. So that's my explanation on that. Kenna takes both Linzess and Motility to help with colonic motility. As I mentioned earlier, I have taken Linzess. When I was on Linzess, it did not help my gastroparesis symptoms at all, and it honestly didn't really help my intestinal motility aside from giving me really loose stools that were also really small in volume and also not that frequent. I have improved. I don't want to so Linzess wasn't great, but I'm not going to say like getting off of it was great because I'm still pretty sick, but Linzess was just bad for me. So talk to your doctor about it. See if it's right for you. But it wasn't good for me. Motility is usually seen as the best choice for those with gastroparesis because it can actually have a positive effect on gastric motility as well as intestinal motility, whereas Linzess really only affects the intestines. Dr. Ficre explains this about prucalopride, which is available under the brand names of both Motility and Resolor. Quote, prucalopride is an agonist of the 5-HT4 receptor, and it works to improve gastrointestinal transit. It is typically used to treat slow transit constipation in females, but also helps to speed up gastric emptying. In a randomized placebo-controlled trial of prucalopride versus placebo in patients with idiopathic gastroparesis, 4 weeks of prucalopride led to improved gastric emptying, reduced symptoms, and better quality of life. The usual dose is 2 milligrams once a day, and it can be increased to 4 milligrams once a day, although higher doses are associated with more side effects, for example, headaches, diarrhea, stuff like that. It can be helpful to trial prucalopride in patients who do not respond to first-line treatment, particularly if they also suffer with constipation. For example, patients with scleroderma or other connective tissue disorders who have upper and lower gastrointestinal hypomotility with slow transit constipation and delayed gastric emptying. The study that Dr. Ficre mentioned here was published in the American Journal of Gastroenterology and is linked in the description of this video if you would like to read it. If you have gastroparesis and want a medication that can improve your gastric emptying on top of your motility, certainly ask your doctor about Motility. However, I found out the hard way that my insurance would not approve Motility for my intestinal dysmotility until I had tried Linzess for a long period of time, because I did not have a gastric emptying scan that showed delayed emptying or any results from a test such as the SMART pill that showed delayed colonic transit time, despite all the x-rays and the CT scan that I had that showed stool burdens. And I am still not on Motility, by the way. As I mentioned at the start of this video, for long-term gastroparesis symptom improvement, surgeries can often be the best option. I am not going to go into deep detail on all the surgical options here, but I will mention the ones that I'm aware of and the ones that, you might suggest asking your doctor about. Dr. Brinkman is a surgeon, and his video goes into detail on all the surgeries that I'm about to mention, and he also gives information about why each of these improves symptoms for a given population. The first surgical treatment that he talks about is the gastric pacemaker or gastric stimulator. The gastric pacemaker was originally thought to improve gastric emptying by getting the muscles to contract as a cardiac pacemaker would. As it turns out, gastric pacemakers are actually neural stimulation and do not improve the rate of gastric emptying at all in the majority of patients. Some patients have mild emptying improvements, but most have no improvement of emptying delay at all. Dr. Brinkman explains that oftentimes in gastroparetic stomachs, the issue is that the stomach is not relaxing at the right time, or it is spasming, and the gastric pacemaker can help with that by re-nervating the stomach. Dr. Brinkman also clarifies this treatment is much more effective in diabetic patients. In his practice, 80% of diabetics have improvement with this surgery, while only 50% of his idiopathic patients have improvement with this surgery. Dr. Ficre elaborates on when gastric pacemakers should be used by stating, quote, "Gastric pacing is thought to work by interfering with sensory transmission to the brain, thereby improving certain symptoms. Results from open-label studies of gastric pacing are mixed. In studies that involve blinding the patients as to whether the pacemaker is on or off, there is no evidence for improvement in symptoms. The best results seem to be in patients with nausea and vomiting who have diabetes and who are not on opiates, so patient selection is crucial. The gastric pacing device can be associated with multiple complications, including device migration, lead displacement, pain at the implantation site, bowel obstruction, and in rare cases, erosion through the skin. In patients who have non-inflammatory connective tissue disorders with skin involvement, there seems to be a high prevalence of complications. So although no studies have formally assessed this yet, in our practice, we do not recommend gastric pacing for these patients. These statements explain why gastric pacemakers are not normally used in people with Ehlers-Danlos syndrome. Since gastric stimulators do have to be replaced every 5 to 10 years, depending on the settings, oftentimes this therapy will be combined with pyloric surgeries or treatments to maximize the efficacy of the device. Pyloric therapy is vary in efficacy from person to person, just like the gastric stimulators. There was one procedure that people can get where the Botox is ingested into the pylorus to keep it more open. This procedure is only consistently effective in about 20% of people, according to Dr. Brinkman, and he thinks that this is because it can be really difficult to get the placement of the Botox injection correct to provide results for the patients. Additionally, if this procedure does improve symptoms, it will have to be repeated once the effect wears off, and for most people, they're going to get diminishing returns with repeat procedures. The most effective surgical option for idiopathic gastroparesis is going to be pyloroplasty. Dr. Brinkman says it works in 75 to 80% of his patients to improve both their symptoms and their rate of gastric emptying, which is freaking amazing. The Cleveland Clinic has a great article with more information about this procedure, and this is how they describe it. Quote, "Pyloroplasty is surgery that alters your pylorus, the muscular valve at the bottom of your stomach. During digestion, your pylorus opens and closes to let food pass from your stomach into your small intestine. You may need pyloroplasty surgery to open up your pylorus if something is making it difficult for food to pass through. Sometimes pyloroplasty capacity, reconstructs your pylorus if another procedure has altered or damaged it. Dr. Brengman also clarifies that research has shown people with idiopathic gastroparesis often have tighter and thicker pyloric muscles compared to other people, so this could explain why the procedure is so effective in that population. Kenna Kay has a couple excellent videos about this procedure, which is also known as the GPOM or the POP procedure. She has a few videos on both the procedure itself and the recovery process afterwards. You do have to follow a liquid diet for the first week or so after the procedure, and then progress to soft foods before eating more normally after like a month or so. For Kenna, the procedure improved her symptoms greatly for about 5 to 6 months before her symptoms slowly got bad again and she was not able to maintain her nutrition. She now has a feeding tube that was surgically placed in her intestines to help with her daily nutrition. I am going to discuss feeding tubes in a future video. They really deserve their own video, but I will say that for a lot of people for whom medications and even potentially the few surgical options out there failed to control their symptoms and allowed them to get proper nutrition, they end up with a feeding tube for enteral nutrition or a PICC line for total parenteral nutrition or TPN. I would not consider feeding tubes or TPN to be treatment options. Rather, I would consider them tools when the few somewhat effective treatments out there for living with this awful disease fail to work at all or fail to control symptoms enough for the person to survive without these life-saving feeding and nutrition devices. That is the main reason why they will be in a separate video, just because they're not really treatments. They're a way of living with the fact that we are starving for a cure. Thank you so much for watching this video. Please subscribe to my channel for more videos about gastroparesis. The next video in this series will be explaining why I know I have gastroparesis despite the results of my scan. So stay tuned for that video. And there's this series for gastroparesis that I have planned honestly spans about 20 videos at least. So there's a lot more coming. Thank you for watching.